Hi, everyone. This is Dr. Kelly and Dr.
Renee,
And we are back. This is what, week 9 or 10? I forget. What did you just say?
9.
Week 9 of us coming to you each and every Friday to give an update of the week in coronavirus. Please share the video. Um, we all want to get this information out. So, the news of the week is that COVID-19 has entered the White House. So apparently, one of the aides for the vice president has COVID-19. And then I think yesterday they said that one of the president's valet, that he or she also has COVID-19 as well. So they're wondering what is going on at the White House. Are they not wearing masks over there? Are they not social distancing over there? Are they setting a good example for the rest of us? And no, like, I think the vice president took some flack last week when he visited, was it a
The hospital.
was a hospital? Oh yeah, it was Mayo Clinic. And he did not have a mask and everyone else had one. And then the president went to some kind of factory that made masks and he had on goggles, but he didn't have on a mask. Anyways, ladies and gentlemen.
But this is the same person that told us to drink bleach. So
pretty much.
Maybe he found out something about it gets in your eyes. I don't know.
People, please still wear your mask. Thankfully, I've been seeing it a lot more here in Atlanta when I go out. And yesterday, for the first time, I tried to find the cafeteria at my hospital, and I didn't know you had to wear a mask. They would not let me in to buy food without a mask. Yes, I had to go back up and go to the vending machine, have a granola bar for lunch. But yeah,
I'm not mad at them.
I mean, it's true. I can't. I have to respect that. So now, whenever I go to the post office, if I go to pick up food for takeout, I always make sure that I'm wearing my mask. Like we always say, it's not to protect me; it's to protect you. If I have coronavirus, and if you have it, if you wear your mask, it's to protect me from you. So if you have a mask, put it on. By now, we should all have access to some kind of mask. The numbers keep going up. There are over 1.2 million cases of COVID-19 here in the U.S. And I think close to 70,000 or maybe a little over 70,000 deaths. Initially, the White House had this criteria that the numbers had to be going down for 14 days before any state reopened. Obviously, we're not following that. We're just opening. So I think maybe
it was either the numbers stay down for 14 days or we just get impatient.
Yeah, I think we're all accepting that people have to die for the economy to open. And I don't know what number of people have to die for it to be acceptable, but I think that's where we're at right now. Like I was telling Renee earlier, like, I've been impacted financially by COVID-19. A lot of people lost jobs, furloughs, pay cuts. Like, I get it. It's painful. But on the other hand, like, how much is your life worth? How much is someone else's life worth, So I think, it's a really tough situation all around.
Yeah. And I'm not willing to give up any of my family members or friends just so that the government can reopen and that the country can reopen. Are you kidding me? So that's why I don't understand this whole, 3,000 deaths a day is acceptable. That is unacceptable to the 3,000 families that are going to be affected. That's not acceptable.
That's the thing. Like, unless it's hit you personally, you're gonna have that stance. Like, I saw a picture yesterday of protesters. I'm not sure, they might have been in Michigan actually, with guns in the Capitol, and they were like this close to the police officers, like screaming at them. And this one African American legislator, she had to bring her own security detail with guns to protect her.
I don't blame her.
I was like, good for you, sister. Good for you. I mean, it's absolutely crazy. Absolutely crazy. But we're still here. We're still alive. We still give thanks for what we have.
Amen.
We're going to get through this. Whenever it ends, we're going to get through this and life will look differently. Tuesday was Cinco de Mayo here in Atlanta, and it looked like any other summer day. People were out drinking their I wanted a margarita too. People were out drinking their margaritas. You probably can't drink a margarita through a mask, so they weren't wearing masks either.
Or they could do the mask like that lady did. They cut the hole in the middle because she said she couldn't breathe.
So I mean, come on, people. Please be safe. Please wear your mask. If you don't have to go get your nails done, don't go to the nail salon. Nobody's nails look good right now.
Right.
It's okay.
It's really okay. When you see the TV news people's hair looking crazy, you guys know that it is clearly okay.
I know. I have some comments here. So, somebody said you've got to be brain dead not to wear a mask when going into any hospital. And that's true. But like I said, the mask is not to protect you. So don't get it twisted. If you wear a mask, you are still at risk for getting coronavirus.
Right. It's
the
not
mask is only useful if you have it. It's preventing you from spreading it to other people. So even if you have a mask on, still do the social distancing, still do the good hand hygiene. And people are really afraid to come into hospitals and clinics. So I heard a report, I forgot what percentage, but like maybe 30% of cancers will go undiagnosed this year because people are afraid to go for their routine checkups. So if you have diabetes, hypertension, heart disease, maybe the risk of you staying home might be, at this point, might be a little bit higher than you going in for your regular checkup. So you still have to balance that. People are still having heart attacks, are still having strokes, even in the midst of this pandemic. So you still need to take care of your overall health.
Yeah, I am actually due for my mammogram, but I think that I'm just gonna hold off on going to the hospital.
I was to get my first one, but it's in November, so I still have time, I guess.
Yeah, and actually they sent me a letter, and then they said they would get back to me because I think that it's non-emergent. They're not really.
Right.
I thank you, Jesus. I don't have breast cancer that we're checking from. We're not following up on some surgery or anything. So I think that I'm kind of on the back end of things. So
Right.
I have not heard back from them. Of course, I will get in touch with them. But we're really not open. So most doctors' offices are not open here.
Right.
So I will definitely call them and to make sure I get my appointment in, because of course that is very important. But I do my monthly checks, so therefore I know that I'm good. If I notice something, I definitely would make sure I call someone.
You do. Ms. Sharon said, Dr. Sharon, I think, says people are not wearing masks here in Indiana as they should. Just so much entitlement here. I think there are cultural differences. I was talking to someone about Barbados, and I'm from Barbados, from the Caribbean. And these people have a 24-hour curfew, meaning that they can only leave their home to go to the grocery store for medical supplies or to get gas, right? If they get stopped by police on the way, they're going to get charged and arrested. 1. 2, they have to go to the grocery store based on where their name falls in the alphabet. And of course, they're not happy, but they're doing it to reduce the spread of coronavirus. Here, we have people going with guns to the Capitol, shouting at police officers doing their jobs.
It's crazy how people just don't, how some people, we have, in the islands, they're like taking it very seriously, which is why their numbers are so low, because they take it very seriously. They're not playing, and they're like, okay, this is what it is. It is what it is. But here, we bend the rule here and bend it over here, and okay, no.
This whole like liberties and freedoms and all of that stuff. If I flew into Barbados right now, I would have to go into mandatory quarantine at a government facility or a government subsidized hotel. If I had to leave now and go back to Barbados, I would have no choice. That's how serious they're taking it. But here, our civil liberties or whatever they say, is being taken from us, and it's crazy. So protect you and protect your family, regardless of what the governor's saying. At the end of the day, it's going to be your loved one that's going to be ill and not theirs. So do what you got to do to protect your family.
And then we just keep hearing about so much not necessarily fair treatment of the patients in the hospitals. So just try to keep your loved ones out of them.
And not only that, people that look like us are the ones that are still dying disproportionately from coronavirus.
And then, you guys had this announcement this week in Georgia that the rate of getting it has increased 40% ever since the government opened up. So, and since the state opened up. So that alone should tell you need to stay home. Yeah. It's gotten worse out there. It's not better. It's more likely you're going to get it.
Yeah. So anyway, breaking news, COVID-19 has entered the White House. We will be back again next Friday for week 10, and maybe we'll have a little bit of a toast or celebration.
I don't know. You guys, we have to laugh to keep from crying because it's just too much. Too much.
Yeah.
You know, we see what you see. So we hear what you hear times 10. Because we hear people on the front lines graphically explaining what's going on. So you do have to chuckle just to prevent from crying. It's just
I know.
much.
So many people that we've known personally have lost loved ones to this. So I'm not making light of it at all, but
No.
It's a lot. It's a lot. So do what you can each day to show gratitude, you know, to be thankful for your loved ones and your family. And if you still have a job, be thankful for that too. So
and happy Mother's Day. We forgot to say that.
Is that on Sunday?
Yeah, it's on Sunday.
Nice.
So happy Mother's Day to all the moms.
Yes, happy Mother's Day.
Neither one of us can be with our moms. So happy Mother's Day.
Yeah. Okay, we will see you guys next week. Bye-bye.
Bye.